So welcome everybody. We're delighted to be here discussing our new book chapter, which is Patient Focussed Interventional Care. And it's released for the first time to coincide with the 10th anniversary of the PCR EAPCI textbook. I'm particularly pleased to be joined by my two co-authors, and I'll introduce those to you in a moment. My name is Robert Byrne. I'm an interventional cardiologist working in Dublin, Ireland. Angela McInerney was the lead author, and she's based at Clínico San Carlos in Madrid. And we're also delighted to work on this project with Mary Galbraith, who's a patient advocate from the Outer Hebrides in Scotland, and also a member of the ESC Patient Forum. Okay, so why is now a good time for a chapter on patient-focused interventional care? Well, I think there's been a number of developments in recent years. It's an integral part of the role of a physician to advocate for patients and to involve them as much as possible in the decisions around their care. But we've also become more structured in involving them in the development of care pathways, of clinical practice guidelines, and indeed the protocols of clinical trials. Moreover, we've realized the importance of developing objective tools to capture patient experience and outcomes when interventions are done. So we felt this was a good time to summarize the evidence for you in this chapter.
I would like to acknowledge the significance of actually having a chapter with a dedicated patient focus. I think it is also most welcomed by patients. I think it must also be acknowledged that having a patient involved in contributing to the patient focus chapter is in itself indicative of interventional cardiology's intention to have patients truly at the centre of what they do. The chapter identifies 8 key component areas of patient-focused interventional care, including key discussions on shared decision-making and informed consent, with patient education central to these discussions. There is also discussion of specific interventional tools that have been created to enhance patient understanding in interventional care. I think a lot of information can be gleaned from patient experience, and indeed patients and clinicians can learn from one another. I was delighted to see the development of specific interventional care prems and also the consideration of further use of PROMs. It is precisely that level of patient consideration that is going to improve patient outcomes, as well as sending a clear message to patients that their experience matters and can and does inform care.
So the ESC EAPCI for a number of years now has been spearheading initiatives aimed at improving patient-centred care by advocating for patients both at a governmental level and also at an individual patient level. And we aimed to summarise these in this chapter. And I think it's worth mentioning 2 initiatives in particular, which are the Patient Forum and the Patient Initiative Committee, both of which are subcommittees of the EAPCI. The Patient Forum is made up of a number of patients who have lived experience of a wide variety of cardiovascular diseases and who, among other activities, act as patient representatives on clinical practice guideline committees and position statements that are produced by the ESC. And secondly, the Patient Initiative Committee aims to develop tools to improve patient care, including patient information videos on a number of interventional procedures and quality improvement initiatives examining patient experience of cath lab procedures and a number of other initiatives which are outlined in this chapter.
So what about future directions for patient-focused interventional care? Well, I think it'll see us doing a better job of informing our patients about the risks and benefits of the procedures that they undergo. It'll see us using more PREMs and more PROMs in everyday clinical practice and also in our clinical trial protocols. It'll also see closer collaboration with patients in developing clinical practice guidelines. We hope that this chapter summarizes a number of the recent developments in this area, and we hope very much that you enjoy reading it.